Hello everyone, my name is Eric Nichols. Just going to do a quick video. I've been doing insurance and in the industry for just over 28 years. My background is I am a full-blown broker, so I represent Medicare, Medicare Advantage, Med Sups, hospital indemnity plans, cancer plans. I have worked at Forethought, which is one of the largest annuity companies in the U.S. I have worked at Genworth, which is the oldest long-term care company in the United States. So I have a pretty extensive background in the insurance industry, as well as a very in-depth knowledge of the veteran benefits. I've worked with veterans for 28 years, so I know quite a bit. And I have a lot of veterans that always say, Eric, I wish you do a YouTube video or post it. So um, today what I did was I did a big PowerPoint. It just is too formal for me. That's not me. So I just put it on a Word document. I'm going to scroll through it with you guys and just kind of talk. But what we're going to talk about most importantly, which a lot of veterans don't understand, is this 72-hour rule. And what that means is if you take an ambulance or if you were to go to the emergency room or if you're admitted to the hospital, you are required to call the VA within 72 hours or they will not help you. They will not pick up copays and bills. So I want to just explain that to you a little bit more in depth to help you. So here's a breakdown. Again, if you're a veteran and you take an ambulance or you go to a non-VA hospital or a non-VA network hospital or ER, I want to show you what's covered. So first of all, you have to be enrolled in the VA healthcare system. So I talk to members a lot of times when they're turning 65 and they may have had company insurance and they'll say, well, Eric, I don't use the VA. I don't know why I would use it. I'm just not going to. And listen, everybody, if you're a veteran, you're entitled to the benefits. It's not that difficult. You're just going to, you can either call the VA if you don't know if you're enrolled or how to do it. I have the number right down here. It's 877-222-VETS or log on to va.gov. But it's really simple to enroll. Once you're enrolled, it's really simple. You're done with. Once you've enrolled, you're going to get a welcome letter. You're going to get a VA ID card, and then you'll have access to VA doctors, clinics, prescriptions, as well as community care. And I'll explain that to you, but it's a office inside the VA that does cover civilian care if you were to need it. So when we go down here a little bit, what you need to do to stay active, excuse me, there is nothing. Once you enroll, you are enrolled forever. You are never going to lose the coverage. So it's worth doing it. Take the time if you're retired. Then just get it done with. It's not that hard. So inactive, can it affect you? It can affect you. So what I mean by that is when you enroll into the VA, there's 8 priority groups, different levels. And I'm going to explain that to help you understand if you don't know how that works. But it just might affect if you haven't been to the VA for years. You might go down in a priority group. It might affect your eligibility for prescriptions or long-term care coverage. So you might just have to reevaluate your level if you haven't went for years. It might even take out again some of your status. So future billing and copays, it can affect that as well. So you might have higher copays with the VA if you've not registered. And community care. So this is very important right here, is you just need to call, check in, do a virtual visit once every 2 years, 24 months, just to really stay active. Because as long as you call and let them know you're active and you're still around, or you do a virtual visit once every 24 months, they're going to help you again with the emergency services, the community care, which again is seeing civilian doctors and specialists outside the network. So it is extremely important. Again, all you're going to do is just a checkup. It's not that hard. Matter of fact, you can even do a virtual checkup. Maybe call every 2 years, update your address, your income if there's different. If you're on a different Advantage plan or supplement or Medicare, just update that just so they know you're still around and active. So now, what is a priority group? So once you enroll in Medicare, they're going to put you in a group. And the higher up, meaning group 1, 2, or 3, what that does is it just means you're going to see the doctor sooner. You're not going to have to wait. You're going to be eligible for maybe more services. You might not have any copays. So for doctors and prescriptions or hospital, you may have zero copays. And that's really just you're going to have more benefits. So here's how it is. And this is just a very simple kind of overview. If you're in group one, that means that you are disability rated 50 to 100%. And as you see over here to the right, there's no copays, and that's the highest priority you can get. You then have group two. That's going to be your 30 to 40% disability ratings. No copays, again, for service-connected care. When you look at veterans in your group three, that's going to be your 10 to 20%. Your former POWs, Purple Heart, Medal of Honor. Most of the care is also covered as well. Group four, that's veterans that get VA aid. They're housebound, they can't leave. Maybe they're catastrophically disabled. And usually with category four, there's no copays as well. Now you're going to get to category five. That's your lower income veterans, maybe receiving a pension or they're on Medicaid. And they're often exempt from copays as well with the VA. Then you have your group six. And now is when it starts to change a little bit. And these are veterans that were exposed to Agent Orange, Camp Lejeune, the Gulf War, those vets that are 5-year post-discharge. And they're going to have maybe some copays here and there to pay. So that's just to kind of really compare what your copays are. Your group seven is your veterans that have a higher income and maybe no service related disability. And they're going to have copays for almost all the different services. And then you do have your group eight, which is similar to group seven. But those are people that have enrolled before 2023. They have limited eligibility. They're going to have copays for most services, and they have some just different benefits. So you can always call and ask what your level is. But why does it matter? It's just simple again. Levels 1 through 3 are going to get more care, and they're going to get faster access to it. If you're a 7 through an 8, you're going to have out-of-pocket and maybe fewer covered services. It can really change based on your income. Another one is always try to increase your disability rating. You can call a VSO, which is a Veteran Service Officer, at a local VFW, local American Legion, or even actually your local courthouses. And you just want to call and ask to talk to a VSO, Veteran Service Officer, and see if they can help you get a higher disability rating. They can pull your service records, they can file your claims and help you. So if you've tried, you've been rejected or whatever, just don't give up. These are benefits you're entitled to. How you're going to find out, again, your disability rating? Right here. You can just call this number, 877-222-VETS. It's right there. But bottom line is once you enroll, you don't lose your coverage, and just kind of you want to stay engaged about one every year, every other year, just by calling and checking in, doing a physical, maybe a virtual visit. It just keeps you eligible for community care and the emergency programs and things like that. So what to do to make sure your VA covers the bills in case of emergency. So this is just confusing for a lot of veterans, but if you need emergency care, as long as you think that you need to go to your nearest emergency, and that's what you always want to know is if you're just sitting there and you say, well, I think maybe I'll go to the hospital, maybe I won't, I'm not sure, maybe I broke my finger, no I didn't, then the VA sometimes struggles with help paying any of that. It's got to be life-threatening or you just needed immediate care, broke a bone, stitches, something major. So you can go to the nearest emergency facility if it's life-threatening or urgent care. You do not need prior approval from the VA. So if you cut yourself and need stitches, if you feel like you're having a heart attack, shortness of breath, if you twist it and dislocate your knee or your hip, or you break your wrist if you fall or whatever, you do not need to call the VA for approval, okay? But what you do need to do, you have to notify them within 72 hours. Have to, have to, have to. This is a must, you guys. You have to do it. If you go into the hospital or ambulance, you need to call the VA within 72 hours. There's a special number. I got it listed right here. It's 844-724-7842. Save that in your phone under veteran 72 hour. Again, if you go to the ER, you take an ambulance, you're in the hospital, you need to call within 72 hours so the VA will start coordinating with copays and bills that they may have to pay, that you're not stuck with all these bills. Also what you want to do is give the VA your hospital info. Sometimes the VA will call for you. So when you have a heart attack, you're in there a couple days, and the person comes around with the cart and they have their computer and they say, "What's your insurance?" You want to tell them, "I have Medicare, I have a Medicare Advantage, MedSup, I have the VA. Do you guys call the VA for me, or do I need to call?" Personally, I think you or your spouse should call, because you're putting it in charge of someone else, and if they forget to call, the VA doesn't care. If they didn't get a phone call within 72 hours, you're kind of out there on your own, okay? Let the nearest VA just know that you've been admitted or you took an ambulance. Follow up just to make sure they got your records, but do not delay, okay? If you need care, go. Do not worry about, should I call the VA, should I not call, what do I need to do? Listen, if it's questionable and you don't care and you don't feel good, get to the hospital. Take an ambulance. It doesn't matter. But don't sit there and worry about calling the VA or getting approval. If you feel it's a risk, just go. Just make sure you call the VA within 72 hours. What does the VA cover? So an ambulance, okay? It covers the ambulance if it was medically necessary. So you can't basically just sit there and say, "Well, I think I'll call the ambulance." Again, you have to feel like it's medically necessary. The ambulance will go. They do cover ground or air. I have some veterans that are in Tennessee or different parts of New Mexico that are kind of out there. So if they take an air ambulance, again, just call the VA within 72 hours. The other thing is you want to call them because they may transport you to the VA. So that's why you really want to call. Emergency room care. The VA covers emergency for non-VA ER visits. So you have to be enrolled in the VA healthcare system. Again, that's where you just call, get enrolled, and you're enrolled forever. So it's not that difficult, you guys. There is no hospital that is close to you. So again, if you can't get to a close VA hospital, again, just go to a local hospital. You can be treated. You don't have to drive 45 miles or 30 miles to the closest VA because you need stitches. If you need stitches and you need care because it's deep enough, go to the VA, just call within 72 hours. It just has to be something that a reasonable person would believe needs immediate attention. Again, you're in the kitchen, you cut yourself deep with a knife, that needs immediate attention. That's not a cut that you're not sure if you need stitches or not. You can do that. But if it needs immediate attention, don't wait, just go and get it taken care of. They'll cover ER, doctor visits, emergency testing, lab work, x-rays, procedures like stitches, broken bones, heart issues. If you got to be admitted from the ER to the hospital, the VA will cover that. If you're in the hospital, if it directly follows an ER visit, again, they're going to cover it. So if it's a related procedure to a follow-up where you were admitted and you need to have a procedure done, again, they're going to do that. So it just has to be timely and, again, within 72 hours. Okay, what the VA may not cover is if it's non-emergency. You just feel like you have the flu and you're not feeling good. If you have other insurances, if you have Medicaid, a Medicare supplement, Medicare, Medicare Advantage plan, the VA is going to be secondary to that. And if you delay notifying them, they may not cover the claim. Well, I know they won't. If you don't call within 72 hours, they are not going to cover it. Or if it's just ongoing treatment. You went to the emergency room, a doctor said follow up, to get you checked out to see if you still have the flu or whatever, they're not going to pay it. Here's an example. So things that the VA will cover: stitches, chest pain, hard, deep breathing, broken bones, severe allergies. If you have a fever, if you think you have COVID, anything you feel needs immediate treatment, or is life threatening, they're going to cover. So here's an example. Let's say you're a 65-year-old. They fell off a ladder, and let's just say in this example, they go to the ER only. So let's say they have a Medicare Advantage plan. Usually there's a $50 copay for the emergency room. So they fell off the ladder, they have chest pains, he thinks he might have broke a rib, he's not sure how serious it is, so he has his spouse drive him to the nearest emergency room. He gets x-rays, he gets evaluated. As long as he calls the VA within 72 hours of that visit, this is actually who's going to pay and what's covered. Since he has a Medicare Advantage plan, they're going to be billed first. Second is going to be the VA, and the VA might cover some of the out-of-pocket costs not paid by the Medicare. It's not always guaranteed. So if there is a ER copay of $50 and you paid it at the ER or the hospital, the VA usually does not reimburse, okay? So have them send you a bill. Just make sure you call the VA within 72 hours. When you get the bill, submit the bill because you've at least started the process, okay? Don't pay the $50 and then think you're going to submit it and get reimbursed. They're probably not going to reimburse you. So the bottom line is, if he paid the $50, he's probably not going to be getting reimbursed at that time. Again, the VA might help cover any additional cost. If there was services or tests that Medicare didn't cover fully, they'll cover that as long as it's within 72 hours. Possibility of the ER or the hospital charges, again, if they were medically necessary and they were authorized and you went in within 72 hours, you're going to be covered, okay? Key tips to remember, again, always call the VA within 72 hours of an emergency room or hospital. Tell the emergency room that you're a VA patient. Give them your VA ID card if you do have it, or your ID. If you have other insurances, the VA is going to be your backup, and you may still have to pay the copay, that $50. But again, if that's the worst case scenario, I had a client that went in last year. They had some chest pains, so they had the CAT scan, the MRI, chest x-rays, $15,000 bill. They didn't call the VA within 72 hours. He called a couple weeks later and the VA said, we're sorry, and he had to pay all of it. If he would have called the VA within 72 hours, he wouldn't have had to worry about it. Worst case scenario, if the VA still rejected it, as long as he had Medicare Advantage, the copay was $50, that's all he would have had to pay, is $50. Instead, he got stuck with a $15,000 bill. Here's scenario number 2. Let's say instead of the ER, he went to the ER, but he was admitted into the hospital. Well, a lot of Medicare Advantages have copays for hospitals, so let's just say it's $200 per day. Let's say he was in there 2 days, and they did call the VA within 72 hours to let them know. What would the VA cover? Well, it might depend. Let's go through this. The VA is not required to cover copays from any insurance plans or Medicare. Okay, remember that. However, if it meets all the VA emergency care rules, then they will pick it up. So again, the VA has to determine that it was an emergency, that you didn't have time to drive 30 miles to the VA because you felt it was life-threatening and emergency, or it was immediate, you needed care, and that you did call within 72 hours of when you were in there, so maybe day 1, day 2, and then the VA may cover the cost of the Medicare Advantage bills that weren't paid, okay? So don't pay the bill when you get it. I got this in bold. Send the bill to the VA when you get it. They don't like to reimburse anyone, and normally they don't. So when you get that bill, for example, in this case, it'd be $400, $200 a day for 2 days. You could then submit it to the VA. They're going to have on file that it was emergency. You called within 72 hours. Most likely, they're going to pay the copay. If they didn't pay it, then you're only stuck with a $400 bill. That bill could have been $20,000, $30,000, $40,000. But again, having a Medicare Advantage protects you from unlimited billing. And normally, if it's within 72 hours, they're going to pick it up for you. But again, don't count on that. Don't just know that worst case scenario, you might have to pay that. But again, it's better than paying the whole bill or getting stuck with that. The VA might help with unpaid costs, okay? So, but again, I have notes here. They generally do not reimburse, okay? Reimburse is the key word. So always submit your bills to the VA first. Whatever they don't pay, then you know that you have to pay that. You're responsible. If you have Medicare A and B, let's say you're not on an Advantage card and you have just the red, white, and blue card only. I have veterans that have that. You really got to be careful. And the reason I say that, you have to be enrolled in the VA. Traditional Medicare is Part A is hospital, Part B is health insurance. So let's say you didn't have a supplement, you didn't have an Advantage plan. Same thing. You went to the VA, you called, or the ER, you fell off the ladder, you called within 72 hours. Here's how it works. Part A is hospital, Part B is going to be the visit, the services, the lab, and the imaging. The VA is not allowed by law to pay second to Medicare. So you'll see it right here. By law, the VA cannot pay for anything Medicare covers. So Medicare is going to cover a big chunk of the bill. Then they're going to give you a deductible or copays. You're responsible for that. And again, it right here, this means the VA won't cover your deductibles, your copays, and coinsurance for Medicare. So in 2025, this is what Medicare looks like. Part A is $1,632 if you just go into the hospital days 1 to 60. Emergency room, you're going to pay 20% of the approved amount, but there is a $240 yearly deductible that you are going to have to pay. And your imaging, your service, and your testing is going to be at 20% coinsurance as well. So that could get quite expensive if you were to go in and only have Medicare A and B. So for example, so will the VA cover any of it? So again, if it's non-service connected emergency, yes. Okay, you just got to notify them within 72 hours. Again, it has to be emergency. You have to feel it was life-threatening, or you needed immediate care. You needed stitches. You cut yourself. You fell off the ladder. You called in 72 hours. You're fine. But if you don't, you could be responsible for some very large deductibles and copays if you only have Medicare A and B. So again, it's based on the VA's rules. So always want to know that. What will the VA not cover? If you didn't call within 72 hours and it was not emergency or life-threatening, you are responsible for the $1,632 for Medicare Part A. You're responsible for the $240 Part B deductible and 20% for the ER doctors, the doctors that are doing the surgeries, or any cost sharing. So bottom line, if you have Medicare A and B and no gap or no advantage, you are responsible for all Medicare's out-of-pocket deductibles and copays if you don't call within 72 hours and it was not life-threatening. Again, you can't just go to the ER because you don't feel good, and because that's not emergency and imminent. If you just don't feel good and you think you got the flu, maybe you do, you don't, you go to the ER, you're going to get stuck with those bills and copays. Okay, it's important to know that. That's why I tell a lot of my members to have an Advantage plan. Because at least if you didn't feel good and you went to the ER and you said, I just don't feel good, maybe I got the flu, I don't got the flu, whatever, $50 is the worst case scenario if you forget to call the VA within 72 hours and the VA doesn't feel that it was immediate and you could have made it to the VA or set an appointment. Okay? If the VA doesn't cover copays and deductibles, then why do we even bother calling that 72-hour line is what I hear a lot. I'll have veterans say, Eric, like, Why do I even have to call the VA within 72 hours? If they say they're not going to cover the deductibles and the copays and I'm responsible, why should I even care? Well, because the 72-hour rule isn't a Medicare rule, okay? It's a veteran rule. So it's about the VA possibility that they're going to pay as long as you've met the 72-hour rule, which again, here's what it is. You have to be enrolled in Medicare, okay? You have to at least see or call or check in with the VA every 24 months, at least once, okay? It has to be, again, emergency. If you don't have other insurances, you don't have Medicare, Medicare Advantage, Medicare isn't covering it, they may pay it. So, for example, again, it just has to be, let's say you don't have Medicare, you have a Medicare A and B only, or you have an Advantage plan, or something like that. Again, in those cases, the VA will probably pay the copays and deductibles, but it's only if you notify them within 72 hours and it follows their rules. So again, we're leaving everything up to the VA to see if they believe you needed it immediately. They believe it was urgent care that you needed. They believe it was life-threatening, and you're leaving it in their hands, okay? The VA may also, and the reason you want to notify them, they may pay for follow-up or transfer care. So if you need to be transferred from the hospital or ER to the VA, as long as you notified them within 72 hours, if you're in the hospital, again, they're going to pay for that transfer. Or if you need community care follow-up, again, that's where the VA approves a civilian doctor or specialist. That's why you call the VA, to let them know. But they don't do that unless the 72-hour rule is in effect. Again, you got to call. It protects your eligibility for emergency benefits. So if you don't notify them within 72 hours, and they may have been able to help you, okay? But now you've lost that opportunity if you didn't call. Otherwise, you're out. But within 72 hours, you've qualified for at least one. Now you got a qualified base that it was an emergency or needed. If you need VA coordinated care, so even if you didn't pay anything, it allows your VA to literally get your prescriptions, or maybe to help you with prescriptions that were provided through a civilian or a local pharmacy. So you may go, and when you leave, they say go to the emergency. So, you break your arm, you're not going to get a prescription and drive to the VA. You're going to go to a local CVS or pharmacy. Again, by literally calling within 72 hours or calling immediate, letting them know, this is how you're going to be protected, okay? And it helps keep the records clear. So just to be clear, the VA does not pay Part A and Part B deductible and copays. It does not pay Medicare Advantage copays, coinsurance at all, okay? Unless it was an emergency, you called within 72 hours, or was immediate care, okay? Here's just a quick summary. Reasons why you want to notify them within 72 hours. I know I feel like I'm beating a dead horse, but it's important. Is that the VA might be the only one paying, okay? The VA might pay for follow-up care, especially for hospital transfers or outpatient care. It's going to document your emergency with the VA and coordinated care if you were to need care outside the VA. So, biggest notes, at the end of the day, what I tell my clients and my seniors is make sure to call the VA within 72 hours. It's hard to get a clear answer. I have called the VA 72-hour hotline. I went to their website. I have called the VA benefits line, and you'll never get the same answer. They always read it to you off their site, which is a little sketchy because they say the word reimbursement. But most of the clients I've talked to that have called within 72 hours, that has been an emergency, and they've submitted their bill to the VA, it's all been paid for, okay? That is the most important thing if you can take away from my video. So here's the 72-hour line. Keep this in your phone, or put it on your refrigerator. 844-724-7842. Here's the VA benefits line. 222-8387. And you can use that to review what your benefits are, to reset a VA doctor appointment, to call community care to see if they'll cover a doctor or specialist outside of VA, if you have Champ VA, and it's even where the suicide hotline is. So what I'd like to show you guys now real quick is where you can get the same information. If you go to va.gov, okay, and I went there, I went to resources, and I just put getting emergency care. Everything that I've told you, this is all they even post on here. There's just not a lot of information. I could have used this instead of the little bullets I put, but it just doesn't say. It just says we must get notified within 72 hours, okay? There's the line again. It must be an emergency room. So it has to be life-threatening or urgent, like a hospital, freestanding emergency room. Urgent care facilities don't qualify. So you have to go to an emergency room, okay? This just lets you know the eligibilities. You know, if mental health, so if you have any mental health issues, it doesn't matter. Even if you're not enrolled in the VA healthcare, you are automatically covered by the VA. So do not worry about that. Here's your general eligibility. And again, authorized care. You guys can go and click all these. And again, it will just keep telling you, you need to meet the requirements. Okay? It has to be emergency and within 72 hours. This will tell you unauthorized emergency for service connected. It will tell you about that. Okay? If you want to go to non-service connected, again, you must meet all the requirements. It's right there in bold. You got to go to an emergency or a hospital. You have to at least see or visit the VA within 24 months, once every 2 years. And it has to be, again, if it's emergency or accident, okay? But it can be illness. It just has to be life-threatening or you felt you needed to go urgent, okay? If you have other insurances, it'll just kind of go through, note insurance copays. We can't reimburse. So if you look at that, if you have other insurance charge copays, we can't reimburse you. This is where I say it, they just don't explain it well, it just says reimbursement. So as long as you go within 72 hours, you notify them, you send them the bills, you should be good. If you paid those bills, good luck getting reimbursed. Outside of the United States, it'll say we can only pay outside of the United States if it is service connected. One of the benefits, if you have a Medicare Advantage plan, they do cover outside of the United States. A lot of times it's like $100 up to about $150 copay, and they cover up to $50,000 to $100,000. Doesn't have to be service related. So if you're taking a cruise or you're in Mexico or Spain, whatever, and you feel sick and it's an emergency, and you go in because you need to go immediately, life-threatening, you can go ahead and Medicare Advantage, call the VA worldwide, and as long as it's within 72 hours, you want to document that, okay? So this kind of lets you know there. If you guys have Facebook, I would go to my Facebook page. You can find me under Independent Insurance Specialist. And this is where I post, and I'll put it in the description, but I would join and subscribe. I just post a lot more articles there. I'm only doing these YouTube videos for clients that have asked me. Some of them want to review it and go through it. But if you go here, I always post articles. So if you look today, I posted exactly what we're talking about. So you could go here, click the drop down, and there it is. This is all the steps that we just talked about in this video, okay? So if you go down to more, my post before that, and this was just 3 simple ideas for veterans that can help you save money if you're on Medicare. Here was key points that could save you money again if you click on it. How to get money back. So this is the veteran Part B reimbursement if you had to go on that. Here's an article. So again, I told you I worked at Forethought. I represent the top annuity companies in the United States. Here was an article where I was discussing income bonuses, 401k rollovers, matching bonuses. Right now, there's an IRA that's paying 6.3% interest, which is an incredible interest. I mean, why have money in a savings or a CD if you can get 6.34% interest? Okay. Urgent care. So I have articles if you're on TRICARE for life. Okay. TRICARE members. That means you're retired from the VA. But again, if you're on TRICARE and for some reason you get a bill, it's a little different with TRICARE because you're just going to fill out a form. It's called DD 2642, and they pay the copay for you. You don't have to worry about the 72-hour with the VA. That's for TRICARE for life members only. But again, this will explain. I'll have members say, I have TRICARE. Why should I get an Advantage plan? It's for the Part B reimbursement because they can go anywhere in the United States. Here's articles again on CD rollovers. I have a video if you're turning 65 to go to Medicare. So I post a lot. I have other videos from YouTube's of veteran specialists also that talk about burn pit, fire pit, veteran service officer. So please feel free to share this video. Feel free to share my Facebook and join that. Again, I hope this really helped you. If you're turning 65, give me a call. If you're on Medicare, you want to review your plan, or if you have questions, my number is 630-400-5445. You can email me directly, eric.nichols@yahoo. So it's ERIC period NICHOLS at Yahoo. But again, reach out to me, message me, let me help you. I've been doing this over 28 years. So I guarantee you, even if you have a plan, let me do a comparison and make sure that you understand what you have. Make sure you know how it works with the VA. And again, I'll post some more videos. Please like this, subscribe, and I'll just keep making videos for you guys to help you understand. And again, this is how I talk to my clients. I like to educate them. They all asked me if I would start doing videos so they can review it. So I'm going to start doing videos. Thank you. God bless. This weekend is Memorial Weekend. So have a great Memorial Weekend and enjoy.